In this video, I'm going to show you how to fix hip and back pain on one side. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, I'm going to go over easy exercises that can give instant relief for one-sided hip and back pain. What usually causes this is because of muscle tightness and weakness. So to make getting relief easy, I'm going to break the video up into two separate parts. In the first part, we're going to focus on improving pain-free range of motion in the hip and the back. Just get everything loosened up. In the second part, we're going to focus on strengthening the muscles that help support that area and hopefully get rid of it for good. As a bonus, all of these exercises can be done at home. They require no special equipment, and you may find give quick pain relief even within seconds. So let's get started and fix that one-sided hip and back pain right now. In the first part, I'm going to go over 3 different exercises that may help improve pain-free range of motion in the hip and the back. These exercises work by helping to loosen muscle tightness and joint stiffness, and you may find they give instant pain relief even within seconds. This first one is called the 90-90 stretch. I really like this one because it's going to help improve hip mobility by targeting external and internal rotation. This one I'm going to start off on a floor. Have one leg in front of you, knee bent at 90 degrees. The other one is going to be off towards the side, knee bent at 90 degrees. So to begin with, what we want to do with this front knee is try to take it down towards the floor as much as possible. If you do have a lot of muscle tightness like glute tightness or just hip arthritis, you'll probably find that you can't get the knee down towards the floor. Do the best you can. What you can do to improve range of motion is to actively take this knee downward as much as you can until you feel a very deep stretch, a comfortable stretch, not to the point of pain. Hold that for 20 seconds, release it, and then repeat it 3 times. With each repetition, you'll notice that the knee goes down just a little bit more until maybe you can touch the floor. From there, I'm going to take my hand off to my side, have my arm straight at my elbow. Let's crawl up with our hand right here until we have very good upright posture, or the best that we can. In this position, you should already start to feel a very deep stretch across both hips, into the glutes, across the pelvis, and also into the back. I'm going to take this one to the next level by straightening my arm and my elbow like this, and then pivoting forward through my waist, through my hips, lowering my chest downward towards the floor. We don't want to round the back with this one, but just keep it straight, pivot forward. The more that you go forward, the more that you're going to feel a deep stretch intensify across the hips and the back. I try to hold this one for 20 to 30 seconds. I just relax and then repeat this one 3 to 5 times. And with each repetition, challenge yourself, build into it just a little bit more. To take this one to even the next level and target a little bit more off to one side, we can put different motions in there to target the muscles and the joints just a little bit differently. So let's say I have a lot of left-sided hip pain or back pain. What I'm going to do is just rotate, kind of twist through my waist right here towards the opposite side. The more that you go over, the more it's going to open up those hips in the back, and it usually feels really, really good. So give that a try for 20 to 30 seconds, and if you feel like it's helping, throw in another rep or 2. You can also rotate towards the side of pain and see how that feels. If it helps, throw more reps in. You can also do a leaning motion. So with this one, what you want to do is lean away from the side of pain. So let's say I have a lot going off to my right side. I'm going to stabilize on the other side. I usually like to grab right at the ankle, put my arm overhead like this, and then just tilt my body straight away from the side of pain. What you'll notice is it opens up the back just a little bit differently. I really feel it from my lower back going down into my hip. This hits a muscle called the QL, or the quadratus lumborum, a big instigator of both back and hip pain. But go through all of those motions. If you feel like any of them are helping out a little bit more, at that point, throw more repetitions in. And when you're done with one position, always switch the position of the legs right here and repeat to hit them both in all angles. So here's an exercise that you can do standing. It's perfect if you're stuck at work and need quick pain relief. It's called the Ballerina. For this one, I'm going to start with very good upright posture. Whatever side that you're having pain, let's say I have a lot of left-sided back pain going towards my hip. What I'm going to do is take the painful side's leg, put it over the other one just like this. Toes pointed straight ahead. The hand on the non-painful side is going to go right on the hip. What I'm going to do with the other hand is put it overhead just like this, so it kind of looks like a ballerina. The movement from here is very easy. What I'm going to do is tilt my body away from the painful side and press my hip towards the painful side at the same time. When you do this, you're going to feel a deep stretch forming in the lower back going down towards the hip. This hits a muscle called the quadratus lumborum, or the QL, a big instigator of one-sided back pain, including hip pain. I like to hold this one comfortably for about 20 seconds. Just do nice, slow, controlled breathing also. From there, just relax, take a breather, and then repeat this one 3 to 5 times. And with each repetition, try to stretch into it just a little bit more. How I like to take this one to the next level is using a door frame to really pinpoint the stretch just a little bit more. So what I'm going to do is put that painful side flush up against that door frame. And what I'm going to do is press into it with my hands so it's a stable anchor point, and at that point, now I lean away from it. It just allows me to have a little bit of a deeper stretch into the back, into the hips. So give that one a try. If you think that it helps out a little bit more, go with that one. But for this, I do try to do it on both sides because you want to keep them in balance. So with this next stretching exercise, we're going to focus on a couple more muscle groups that are big instigators of one-sided hip and back pain. It's going to be 2 separate movements. The first movement is called the 3D hip flexor stretch. It's going to focus more on the front of the leg, the hip flexors, including the psoas muscle. This one we need a sturdy chair, one without wheels, but you can also use a staircase. So whatever side that you're having pain, let's say I'm having a lot on my left side, I'm going to take the non-painful side, put it up on the chair like this. Let's keep the back painful side's legs straight at the knee, and then just put it behind us just a little bit. Make sure that your foot is flat. What we want from there is very good upright posture. Take your hands, put them right on your hips. The first movement, very easy. I'm just going to lunge forward with my body weight, really moving through my waist, through my hips. The more that you go forward, the more that you're going to feel a deep stretch forming in the front of the back leg. That's hitting that psoas muscle and those hip flexors. Hold this for 20 to 30 seconds. You want to do nice, slow, controlled breathing also. From there, just relax and then repeat this one for 3 to 5 times. And with each repetition, build into it just a little bit more. From here, we can take it to the next level by hitting it at just different spots with different movements. So I'm going to go back into that original lunge position, but this time around, I'm going to put my hands in front of me, kind of like a genie position, and then I'm going to rotate my body away from the side of pain. It will hit the hip and the back just a little bit differently. So give that one a try. You can also rotate towards the side of pain. And I also like to do what is known as a lateral lean. So I'm going to go back into that original position, put my hand at 90 degrees, I should say my elbow at 90 degrees on the painful side, and then I'm going to tilt away from the painful side with my body moving through my waist, through my hips. That hits that QL, that quadratus lumborum muscle that we were talking about earlier. So go through all of those positions, and if you feel like one just offers you more relief, it's really hitting that tight, achy spot, at that point, throw more repetitions in. In the second part, we're going to focus more on the glutes and a muscle called the piriformis. So what I'm going to do is sit right at the edge of my chair or your stair, whatever side that you're having pain. This time around, let's say it's my right side. What I'm going to do is bring that leg up, rest my ankle over the other side's knee. So when you look down, it should look like a figure 4. So this is known as a seated figure 4, or if you're into yoga, a seated pigeon pose. So what we want to do is try to take this knee downward as much as we can, but we're not going to press into it. Don't crank into it. What you want to do is just actively press down as much as you can until you feel a very deep stretch forming over the glute, over the hip, and also into that piriformis muscle. It should feel really deep to the glute at that point. Once we feel that, what I'm going to do is have very good upright posture, and then I'm going to pivot forward through my waist, through my hips. I'm not trying to round my back into this one. Move through your waist. The more that you go forward, the more it's going to intensify that stretch, and it usually feels really, really good. So I try to hold this one for 20 to 30 seconds. I come back up and then repeat it up to 5 times. With each repetition, go into it just a little bit more. So with this movement, you can also do rotation and that tilt like we did earlier. So just pivot forward again, put your hands in front of you like this. You can rotate away from pain or you can rotate towards it. Anything that feels better, throw more repetitions in at that point. If you want to focus a little bit more off into the lower back, hitting that QL muscle, what you do is just have very good upright posture, and then what you do from there is just tilt away from the side of pain. That will help open up the lower back. So go through all of those motions. If anything is pinpointing that pain and just hitting that spot of tightness, stiffness, whatever, a little bit more, throw more repetitions in. And I do recommend doing this on both sides to keep them in balance. In this part, we're going to focus on getting rid of hip and back pain for good by strengthening the muscles and soft tissue that support the hips, the pelvis, and the back. This is called the Figure 4 bridge. It's a great daily exercise that you can do in bed or on a floor. So what I'm going to do is start off lying flat on my back. If you're unfamiliar with the bridge, it's a very back-friendly exercise that's going to target a lot of muscles. So what I'm going to do is get in that position first. Have your knees bent, feet flat, take your hands, put them on your hips. You're going to tighten your core muscles, squeeze your glutes, lift your hips upward towards the ceiling until your body is in a nice straight line from your knees to your hips to your shoulders. You should feel a ton of muscles firing, the core, the lower back, the glutes, the legs. We're going to take this one to the next level by taking one leg up off the bed or the floor and then putting the ankle over the other side's knee to form a Figure 4. In this position, you should feel a ton firing on the glute right here that is driving upward towards the ceiling. And on the other side, you should feel a deep stretch forming in the hip and also over that glute and the piriformis. So it helps strengthen and lengthen at the same time. I try to hold this one for about 5 seconds. From there, I'm just going to relax, take a breather, and then I'm going to repeat this one up to 10 times. With each repetition, build into it just a little bit more. And whatever you do on one side, always switch to the other side to repeat. You can also focus on the hips a little bit more by doing what is known as a clamshell bridge. So I'm going to put my feet together and then I'm going to take my knees and drive them outward as much as I can until I feel a very good activation of the inner leg muscles and also into the hips. From there, the movement is very similar. We're just going to put our hands on our hips and then drive our hips upward towards the ceiling. This one will just put a little bit more focus on those glutes and across the hips. 5-second hold, you're going to relax and then repeat this one up to 10 times. And with this, if you feel like you have a little bit more energy, you can throw in another set or two. So here's another really easy hip and back strengthening exercise that you can do daily. It's called the hip hiker, and it's going to put a little bit more focus on the quadratus lumborum and the glute muscles. And all we need is a staircase for this one. So every time that you go upstairs, throw in a couple reps. It probably will add up over time. I'm going to start by putting one foot up on a stair. The other is going to go right off to the side. The movement, pretty straightforward. Take your hand, put it on your hip, and then drive that hip upward towards the ceiling as much as you can. You'll feel a deep activation across the hip into the lower back. It's going to hit that QL muscle. You want to hold this one right here for about 5 seconds. From there, just relax, and then you're going to repeat this up to 10 to 15 times. With each repetition, drive that hip up just a little bit more. And then when you're done on one side, I do recommend switching to the other and repeating. And if you feel like you have a little bit more energy, throw in another set or two. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.